Thank you very much, Lochna. I would like to continue with my slide. That is uh, some of the studies have found that some because of some long-term climate warming trends, it favors of an environment uh, to vector-borne diseases, and that vectors leads an infectious disease outbreak. This has been stated in Ostfeld and Bonner 2015 journal. Some of the extreme weather conditions helps, and they create opportunities to more clustered diseases and outbreaks in some non-traditional places and time. Overall, climate conditions constraints the geographic and seasonal distribution of infectious diseases. Some of the evidence of the climate change are heat waves. Heat waves are usually because of a rising temperature on Earth, and rising temperature is because of rising of air pollution and carbon dioxide level on the Earth. This leads an favorable environment for vector-borne diseases like West Nile River in Israel 2000. This has been stated in Pest Journal 2006. Some of the airborne diseases are also been evidenced of because of heat waves, and they leads infectious respiratory diseases, and and this increases higher rate of morbidity and mortality rate. Drought is the other evidence of climate change. Because of drought, the people are being sheltered in refugee camps, and in those refugee camps, it becomes a favorable environment for diarrheal diseases, and some of the vector-borne diseases are also increased in those periods, like heptavirus pulmonary syndrome (HPS), and this has been increased in West Nile virus risk as well. Because of flood, usually flood is because of high water level, either because of heavy rainfall or because of when ice melt from glacier region. Um, Usually, it leads an favorable environment for vector-borne diseases like cryptosporium infection. Even in flood affected areas, people are been either sheltered, or that the area which is affected by flood, it becomes an healthy environment for vectors to grow, and diseases like typhoid, cholera, Ross River are very common in flood affected regions. Hurricane is other evidence of climate change. Hurricane affected areas are highly susceptible for vector-borne diseases like malaria and dengue fever. As it's in Epstein 2000 journal, in Venezuela, it's been recorded. A cyclone is other evidence of climate change. Because of cyclone, some of the vector-borne diseases occurs like leptospirosis, water and foodborne diseases like cholera are also observed. Now, we will see what is risk management strategy. During the time of outbreak, all risk management strategy comes into the action. First, what is risk management strategy? It is a coherent approach, and a structured coherent approach to identify, assess and manage the outbreak. How to manage the outbreak? First is to identify. Identification is done from the retrospective studies. Second is to assess the risk. We will do medical examination. We will do lab test to identify the risk. Third is to control the risk. We will provide all the control measures to the affected people, and fourth is to review the risk. After controlling the outbreak, we will review what was the cause of that outbreak and what precautions can be taken to control the outbreak. As per the World Health Organization, There is an assessment, management, and control framework provided to manage, assess, and treat potential outbreak. First step is to or is a responsive intervention in an epidemic phase. The idea and the outbreak is been assessed. Second is to anticipate and early detection with the help of lab test or diagnostic test. The uh, pathogen when introduced is been identified. Third is to contaminate and control over the local transmission. All the preventive measures can be taken from the government side are put into the action, and it's been tried to stop the transmission. Third is to control and mitigation. All the medications are been implicated, and most of the outbreaks are been tried to mitigate and control. Then review or elimination. We can up to some extent we can eliminate the risk, or but we cannot eradicate any diseases. So reduce with the help of elimination we can reduce the transmission of the diseases. And after that we will review, and the data will be collected and stored for the sake of for the care of further. So, now, what is anticipation? It is a first stage of responsive emergence which cannot be predicted, but it can certainly be anticipated. And anticipation of the risk enables to focus most likely threats. How how anticipation encompasses it's been forecasted most likely to the disease emergence, and quick identification of the drives will worsen the impact of to facilitate provide in preparedness of plans based on lessons learned from the past, like from the lessons learned from the retrospective studies. Past experience, it should contain a variety of scenarios to allow a reactive response to an unexpected outbreak. Early detection helps in the control over the outbreak. Majorly, it is one of the most important part of a risk management strategy, which helps in the spread of outbreak. Early detection allows a rapid implication to a contaminants, which are the key reducing risk of implication in international spread. International, like as we observed in SARS outbreak, international travel was been stopped. Also, in 2014 and 2012, Ebola outbreak was spread across the world because of an international travel. Their role is there. This is also to reduce the risk over the community transmission by isolating severely ill patients. After identification of the patient, infected patient, that patient is been isolated from the community, so that community can be saved from the diseases. This way early detection helps in spread of diseases. Contaminants are effective and rapid. Contaminants are effective and rapid in disease emergence. Uh, because of contaminant identification of contaminant, we can help to treat the patients. Control and mitigation helps to stop the spread of diseases, as we discussed in further slides. Elimination can be done of the disease. Eradication, we can up to some extent we can eradicate the risk also, as we have discussed in the previous slides. Uh, Risk management strategy helps provide spread of diseases. These are the few benefits to improve, mitigate, and improve the competitive of outbreak. Thank you very much. Me and my colleague Lochna presented our topic on climate change, and up to we have provided risk management strategy. and a framework to control disease outbreak. And Lochna explained what is climate change in her first part and what are the factors. Thank you.